Hi, this is Angela with Angela's Nurse Toolbox. We're going to take a tour of labor and delivery today so you can kind of understand the basic instruments that you may see or encounter when you're in clinicals or if you're in the hospital getting ready to have a baby. I'm going to go over some basics for you. Okay, so when you're in the hospital, we would be monitoring the baby. This one is the one that's going to monitor the baby's heart rate. Okay. You'll hear the little sound it makes. We usually put this on the lower part of mom's abdomen to find the heartbeat. And the one that says UC, this one is for contractions. There's a button that when it's pressed, because your stomach, your uterus is contracting, it would cause the numbers to increase, and that's how it picks up the contractions on the mom's belly. And I always ask where she's feeling her contractions the most. That way we can pick it up really well. So I'm going to just kind of show you whenever we have the heartbeat, the monitor would be picking up the heart. So the heart would have been in the 140s right now, 160s. This UC, that's your contraction number. Let me show you that. So when you're contracting, this number is going to slowly increase till it gets to its peak, and then it's going to decrease as the contraction's going away. It's going to go down. Increase with contractions and decrease. All right, so that's what we would see with the external monitors. Okay, if you would be looking at the monitor, the computer monitor, or the paper that would be coming out of the machine that's monitoring mom, the top number up here, you see it goes from like 30, 60, 90, 120, 150, 180s. This is the baby's heartbeat, and it should fluctuate, go up and down a little bit in response to having contractions. And usually it's either a blue or a green area that's just showing you that's the normal. So it's normally 120s to 160s, okay, but it can vary. The bottom area right here where you see this hill, this is where we're picking up contractions. So each little hill is a contraction. Now it doesn't tell us how strong it is, it's just telling them that we're having a contraction. There's different monitors that we can use to see how strong it is. Each black line is 1 minute, so we can tell how far apart it is. So here's 1, 2, about 2.5 minutes before that next contraction starts to happen. Okay, so the bottom is your contractions. They look like little hills. And the top part is the baby's heartbeat. So let's move on to internal monitors. All right, if we're trying to monitor the baby's heart rate really well, maybe the baby is not staying on the monitor and we may be inducing mom with Pitocin, and we need to see if the baby's heart rate's dipping or not. And we need to really know for sure. We might put on this. This is an internal scalp electrode. This little silver part, actually goes in superficially to the baby's scalp. It screws on a little bit, just a few little rotations. And this would be connected to the baby. Baby would be born and they can remove this, but this would help us know for sure what the baby's heart rate is doing in response to contractions, to make sure the baby is not in distress. The next one is the internal pressure catheter. Okay, this tube, they would slide up along the side of your uterus, inside your uterus. And what it's going to do, it measures the pressure, how strong your uterus is contracting with each contraction, to make sure it's not too low and it's not too strong. So they're making sure, and they usually use this if you're being induced, to make sure that we're getting your Pitocin the right way to stimulate your contractions, that your uterus is trying to contract really well in response to the Pitocin. We also can use this same instrument. There is a little knob right here that we can unscrew. Sometimes the baby has a bowel movement, and we can hook an IV tubing right here. And this will use to be rinsing out the inside of the uterus. Okay, so it will rinse out the uterus so the baby hopefully does not swallow any of that bowel movement or the meconium. Okay, and they rinse. We might also do this if the baby's having a lot of dips in the heart rate due to the water bag being broken. We might give this to give a little extra cush or fluid. But in order for that to happen for these internal monitors, we do need to use an amni hook. So this is what an amni hook looks like. When the doctor comes to break your water bag, it looks like a little crochet hook. It's plastic, but it's going to go ahead and snag a part of the water bag to pop the water bag. Okay, when they do pop the water bag, we pay attention to the amount of fluid, the color of the fluid. Every time mom has a contraction, it will be leaking out a little bit. So we have to make sure we change the pads under mom often, okay, because we don't want mom to get diaper rash before that baby comes out. Another tool that you may see in labor and delivery is a handheld little vacuum. This is to help bring the baby down. If mom is having problems pushing the baby out, maternal exhaustion, baby's having some variables with the heart rate dropping, the doctor may choose to try to get the baby out a little quicker. So they're going to put this little cone onto the baby's head, and they will pump it to where the pressure is in the green realm. And as mom's having a contraction, they're going to use steady pressure and kind of help pull the baby down. Okay, and this is only supposed to be used a few times in delivery to pull it down. Your baby might have a little cone head right here after as a result of the vacuum. So those are some of the instruments that are used in labor and delivery. I hope this helped. Those that are nursing students that are getting ready to go to maternity clinicals, and those that may be going into labor soon. Hopefully you have some better knowledge and understanding of things that are going to go on in the labor and delivery room. If you like, subscribe to my channel. This is Angela's Nurse Toolbox.